Shilpa Rao. I head the breast services and I'm a professor in general surgery at the SIT GNSMC and KEM Hospital. At the age of 16, I don't think it's passion driven, it's peer pressure driven, and it's family influences which drive us. So that's what drove me into medicine. Everybody in my family were doctors. But yeah, the passion came in when I had to decide surgery. And that passion has been only rising. It's a complete art and science form, and it still continues to excite me even today. So the passion, I think, started once I decided to do surgery as my career choice. So I can think of two kinds of role models here. One is the typical type I didn't want to be, and that helped me actually much more than the role models who are very far and between in our times. So I think it was a balance of what I should not be, and a balance of people rare but still there, who are strong in their own might, own power, and who are strong enough to give an helping hand and give a kick or a push when required. And yes, I have been lucky to actually have some of them, and without naming them, thanks a lot. I think my answer to your first question would also address the second to a point. So I think the most commonly felt issue is life-work balance. But I think as a woman, it's not just the difficulty of having a life-work balance, it's the guilt which comes from actually trying to, keep compromising on the life-work balance far more than maybe our male counterparts. And it took me a long time to get over that guilt and accept this as a part of what I am. But yes, it still afflicts a lot of women today. And in 2024, the Association of Surgeons of India, which is a national body, has identified the need for a women's cell where women in surgery women like me, much older women like me, can be mentors to the upcoming women, so that they just have a shoulder, they just have a ear to vent on. And I think that's just what most of us really need, the support. We are all independent and we are all good at what we do, but just that small support every once in a while is, I think, what will make us more stronger and united. So precision medicine is where I'm looking at things will be going. I had the breast services, and I must tell you here that this is the first multidisciplinary unit which existed or which still exists in any public hospital in Maharashtra. It's a success story of its own, and because it's cancer, a lot of times we are still facing drawbacks. We are losing patients. So I think precision-based medicine, where the medicine is given with the least possible side effects to ensure that there is a completion of treatment at a cost-effective price. That's one place I'm looking at. The other, in terms of education, I think AI and and of course robotics is coming in its own way in other fields. But I think these will be kind of proving to be pretty competitive for the medical professionals. Not surgeons maybe so much, but yes, AI is getting there, and so is precision medicine. But I think it will make us better at treating patients more holistically. If you're looking at patient-related experiences, I think the 1993 riots was something that's going to stay with me for the rest of my life. We were to give our exams, our master's exams, and there was no time to study, there was no time to do anything. We didn't even have the guts to ask for leave because of the chaos that Mumbai was facing. And every patient there had a story. So there was this very young boy, I still remember, and he came with multiple gunshot wounds to the abdomen, and he had been operated in a couple of other places, and he developed some complications, so he was brought to our place. And staplers had come in for the first time at that point in time, so we used one of the first staplers on him. And then 3 years down the line, I was shopping down Linking Road, and I have this guy coming to me with this X-ray in his hand, showing me the stapler circle. And it makes you feel so validated. But so many stories of that time, and and every patient teaches you a story. So I think not enough time here.